The question is, how much is Medicare reimbursing the home health agency after you have sent the nurse to do a visit? I would like to know, what is the profit for the agency? To answer this question, first I'm going to explain to you how Medicare billing for home health agency is different from Medicaid billing for home health agencies. Medicaid billing for home health agency is based on A unit is 15 minutes, or B, a visit. A visit is 1 hour, 60 minutes. Home health agency, non-Medicare, usually bill units and visits. A unit for Medicare home health agency is 30 days, right? So you bill a 30-day visit into that billing. So if you bill Medicare, you're billing 30 days. Medicare plan of cares are recertified every 60 days. How much money you make on that 30 days and the subsequent following 30 days after 60 days depends on something called case mix. A case mix is based on the patient condition and what they require. For example, if a physician authorizes a patient, a home health agency, and that patient had a hip replacement, that patient will require a nurse for after surgery care. That patient will require a home health aide for their daily living activity, since they cannot walk about and do whatever they need to do. And number 3, that patient will require a physical therapy. So right there, that patient requires 3 services. And the services, if a doctor signs off, by the way, Medicare services are signed off by the attending provider, the physician for that patient. So therefore, if a doctor signs off those 3 services, now your payment have a case mix adjustment for that 30 days. Now it's no longer just the skilled nursing that you're going to get paid for 30 days. Now, how much you're going to pay the nurse, how much you're going to pay the home health aide, how much you're going to pay the physical therapist, all depends on what the goal is and how close the patient is to goal. Since the unit is 30 days, you can send a nurse there 7 days a week or twice a week, but the money it's not going to change. So how many visits someone provides in a specific service type has nothing to do with how much you got approved for it. How much you got approved for is determined on when you wrote the plan of care and you did the OAS assessment, what you wrote down the patient required. Patient needed a physical therapy, occupational therapy maybe. The patient needed skilled nursing, needed a home health aide, and what type of what was the primary diagnosis, what was the second diagnosis. That's how much you get, a bunch of money at one time every 30 days. Well, let's say you take that money and you say, well, these 30 days I'm going to go ahead and provide, the first week I'm going to provide 3 visits of skilled nursing in that house to make sure the patient really understands what they're supposed to do on the first week. I'm also going to send a home health aide there at least I'll say 4 times this week. But the following week, I'm going to reduce the RN visit to 2 visits. But I'm going to continue to do the home health aide. I'm also going to send a physical therapy there once the first week, maybe twice. But I'm going to do that 1 visit on the second week, and maybe another visit on the second week. And then on the 4th week, I'm going to have the PT to go back there. And I'm going to reduce the RN visits to 1 and 1 on week 3 and week 4. To see how the patient is doing, and so on, maybe once a week until the end of the episode, which is 60 days. A home health aides, I'm going to reduce the hours that they're going there. And the goal of this Medicare is it's a goal-oriented business. The patient's supposed to get better after a number of episodes, and you put that down. The nurse who did the assessment put that down, that the patient will get better at X number of days or visits or so on. So how much money you make depends on how ridiculous your nurse is who did the assessment, and when she put down how the goal she is. If she put down the goals to be have a nurse there 7 days a week, well, you're not going to make any money, because you're paying all the money to the nurse there. But the nurse doesn't need to go there every 7 days, 7 days a week. She just needs to teach the patient what they need to do and let the patient take over. That is how Medicare bills. It's not per visit, it's per unit, and a unit is 30 days. How Medicaid is per unit, and a unit is either 15 minutes or 1 hour. You see right there. So how much money you make, how much profit you make, all depends on how well the patient, how well your nurse documents what the patient requires, and how fast you reach the goal that you have documented. I hope that helps.